Hi everybody, this is Dr. Jonny and welcome to another Metabolic Mastery Club call. And today I'm very excited to introduce you to one of my new best friends, Dr. KIMDERAMO, who I met at a MindShare Summit, which is the MindShare Summit. If you guys don't know, because I get a lot of my interview subjects from the MindShare Summit, is a huge mastermind of health professionals all working towards the same goals and sharing different information and technologies. And we meet a couple times a year, and it's organized by J.J. Surgeon. And Dr. Kim is a member of that group with me, and I was just so delighted to spend time with her at the last Sapphire Group meeting, where we really got to exchange a lot of information, got to know each other better, and share things with our colleagues. So I was just so excited to be able to interview her today, because she really brings something to the table that I don't think we've talked about a lot on these calls, and that has to do with energy medicine, mind-body connection, and all the rest of the good stuff that I know she's going to talk to us about today. So without further ado, let me welcome my new best friend, Dr. KIMDERAMO. Hi.
Thanks, Jonny. I'm so excited to be here. I love you. I love what you're doing. This is great.
Thank you so much. Let's start with, now your background is in emergency medicine. Just give us a brief second about what that is, because I don't even really know what emergency medicine is, and then we can talk about how you transitioned into something that sounds so very different.
I was trained, I went to medical school and became an osteopathic doctor, which is a physician, and, we practice medicine and surgery and all of that, but we're also trained in how the body heals itself. How does that work? When we learn about the placebo effect or spontaneous healings or things like that, we tend to think that's just a miracle but not medical, when in fact it is known, and there's a lot of science and research to show how the body heals itself. So in medical school, I really was drawn to that, so I went to an osteopathic program, but my training is in emergency medicine, so my residency program was in trauma and emergency, like when someone has a heart attack or they can't breathe or, any kind of emergency. That's what we were doing on a regular basis. So it's sort of like a background in both worlds of allopathic medicine. I trained at a level 1 trauma center at Emory University, and also the healing arts of how the body heals itself. So it was just natural for me to begin paying attention to what makes people heal and then what is holding them back from healing, as opposed to how most medical doctors will look at things and say, what's causing this disease, what's causing this disease. If you understand that the body heals itself, then the question really turns into what's preventing it from healing itself, what's in the way of that, and you have a whole different list of sort of information that comes up when you begin to ask those kinds of questions.
Very interesting. What I find fascinating just personally about you is that is such a different orientation. For example, I always say that Western medicine is phenomenal when it comes to saving lives. I always say that if I, God forbid, get hit by a car, take me to see the Sinai, not to an herbalist, not to an acupuncturist. But here, but where modern medicine really, where Western medicine really fails, is in the area of preventive medicine and keeping people well. And what I find so interesting about your transition, if you will, from, let's fix it up right now and keep the guy alive and stick a tube down his throat and, patch up his heart, to what can keep people well and healed so they never get to the emergency room. I find that to be a very interesting transition. What caused you to go from, one to the other?
Well, 85% to maybe 90% of the people who present to the emergency room for help actually don't have any organic medical illness. So they do fall into that group of, like you're saying, that they don't have that emergency where we need to put their arm back on or we need to get their heart to start up or there's some kind of medical emergency. And in this field, there really isn't anything to offer patients other than we can help you stay alive longer. If you have diabetes, we'll keep you from dying of your diabetes, but what do we have that will help you so you no longer have diabetes, so you're healthy and vibrant and whole? So for me, it made so much sense to begin to study this art for what most of the people coming to a doctor are actually looking for, and be able to have something that I could offer them. And what I found with MindBody Medicine really blown my world up in a really great way, to understand how simple it can be for us to heal, for us to enter into that state of well-being.
Now, you had some personal health issues, didn't you, that also kind of fueled your own journey?
I was diagnosed with like a whole bunch of things, and it's kind of the whole slew of what most patients seeking help from a doctor are dealing with. They don't feel good. They don't know why. They're tired, sluggish. Maybe there's weight gain. Maybe there's some kind of metabolic problem and they're not managing sugars. It could be anything. But it's like, why do I feel it this way? And for most of those people, there isn't a really clear understanding of like what's going on with you. So then we have these diagnoses of like, well, you have fibromyalgia, or you have chronic fatigue syndrome, or you have hypothyroid disease. And really it's a little bit bogus because none of those diagnoses point to the underlying cause of where the problem really is. Meaning, yes, it's a quote-unquote real diagnosis. The person has a real problem, but it isn't a useful diagnosis in that it tells me, oh, you've got this kind of a toxic overload from your food, or you've got this kind of a genetic thing here. None of those are actually what's going on for like 85% of the people. And in fact, what's really happening is an underlying discrepancy that can be dealt with MindBody Medicine very quickly and very easily. So when I was in that situation, and it was like, maybe a couple of years, tired, sluggish, feeling like I had fevers and chills all the time, getting sick really frequently, sinus infections, like all kinds of problems. But every doctor I went to had just kind of like a microscopic way of looking at it. Okay, let's look at your thyroid. Well, you got some labs that are off, but it's not really a thyroid disease. Well, it's not really, juvenile rheumatoid arthritis. I had a lot of joint pain and joint aches. And so finally I was sent to an allergist, and it was through this infectious disease doctor. Like every doctor I went to was going to be the answer. And the infectious disease guy was like, you don't have Lyme, you don't have this disease or that disease, you have allergies. I know what this looks like. My daughter has this. You feel absolutely miserable. And he was right. So I went to the allergist, and this was a guy from Harvard University and the best of the best because I was in the Boston area at the time. And he sat there and did every lab under the sun, and he tested me up and down my back, up and down my arm, and I was allergic, meaning like my body flared up against every single allergen that they injected under the skin. And so then he sat there with me in this little intervention in his office and told me, this is your condition, this is what's wrong with you, and this is what you need to do. And there's these drugs and these medications, and then there's these, shots you're going to need, and these cleaning solutions, and then you can't have this kind of pillow, and you can't have curtains or rugs. And my head started spinning. I was a third-year medical student at the time, and I saw my whole life that I had planned just flash before my eyes. Like, there's no way I can continue to move around and live in a different hospital every month and do my running and my whole lifestyle with this understanding. And so all of a sudden, before I started breaking down into tears, I was like, wait a minute. This isn't even true. Like, nothing he's saying is necessarily real. And I don't buy it. Why, I asked instead, why is my body reacting to all of these allergens? Because a year ago, 2 years ago, it didn't react. So it's not the truth that this is how you are and this is how your disease is, period, the end. I don't believe any of that. And so in that moment, it really changed for me. And I started to apply the principles of MindBody Medicine, which I had learned so much about, but not really been taught to implement. And I started to find ways to implement it myself and get my mind to heal my body. And in 10 days, I had no symptoms, no joint pain, no fatigue. I started shedding the weight easily, and my labs returned to normal. So this just completely transformed my understanding and practice of medicine.
Let me ask you a question. Give us a elevator speech, 15-second helicopter view of what MindBody Medicine is, for those who might not have a clear idea.
The way that I use MindBody Medicine is MindBody Tools. So I give you tools that connect you with the source energy that created you and heals your body. And it's instantaneous when you use these tools. It instantly connects you to the source of your well-being and reverses that process of disease.
Very well. Can you elaborate on that a little bit? I know you're going to mention this later. Your book, which is I think #1 on Amazon right now, is it not? MindBody
Yes.
Tool Kit. I imagine uses a lot of these tools, but can you tell us how the mind and body are connected, what this kind of, because a lot of people who are kind of very science-oriented probably poo-poo some of this stuff, maybe not as much as they did a decade or 2 decades ago, but can you give us some of the kind of the reasoning behind why what we think about would so impact our actual metabolism and physiology?
Every thought that you have creates a chemical response. Thoughts are chemistry. They're neurochemicals. But those neurochemicals aren't specific just to your brain, as was previously thought for a very long time in the practice of medicine. Those neurochemicals also interact at your heart, at your lungs, at your kidney, and create changes in every level. They even affect what's happening in your genes. So if you have genes for overweight and genes for diabetes or genes for cancer, your thoughts, the types of chemicals you're creating in every moment, can have an effect to actually turn those genes off. Now, what happens from the sum total of kind of all the thoughts that are floating around, and most of them are subconscious. You're not consciously aware of the records playing and the sort of neural signals firing off from your brain to your body, but they're happening in every moment. And they will either create an effect of well-being, or they will have the opposite effect, and they limit well-being. You get inflammatory cascade and all the inflammatory chemicals, bradykinin and the stress hormones and cortisol. And these have all been shown to directly create all the illnesses that most people are dying from. So not only fibromyalgia, chronic fatigue, thyroid disease, weight gain, but also cancer and stroke and diabetes and, all of the major, we're putting billions of dollars into trying to cure these illnesses, but they have been shown to be created from this underlying inflammatory chemical cascade that is actually controlled by your mindset. So if we can learn, and we've shown in so many decades of studies, medical, clinical studies, that, meditation or Tai Chi or yoga or doing a body scan, bringing your awareness into your body does have the effect to immediately create the healthy chemicals and to stop that toxic chemical cascade. But most people just don't have tools. Like, for me, it wasn't like I was going to go sit and meditate for an hour every day. But I could use a quick MindBody tool in a given moment when a symptom came up to release and reverse the process. So that's what I'm training people to do.
Wow, that's great. Now, a couple of things. There's so many thoughts and questions that popped into my mind as you were talking about. The first was, I guess, I first heard the term MindBody in terms of the work of Herbert Benson at Harvard and the MindBody Institute. And I know that there is decades worth of strong scientific research on meditation and alpha waves and all the other things that it does. And he's accumulated all that research on the mind in the MindBody Institute. It's all on their website and stuff. Is that where this all got started, that connection that Benson found? The relaxation response was one of his popular books, and it was talking about how when you put your mind in this meditative state or even this relaxed state, that there's an entire physiological cascade like you're talking about that actually has biological and physiological effects. Is that where this all got started?
Yes and no. This has been around for thousands of years, and the understanding of the body's ability to heal itself, of the mind and body being connected, is hundreds of years old in the practice of medicine. As an osteopath, osteopathic medicine was introduced in the late 1800s. It was completely poo-pooed, and, the doctor who created it, A.T. Still, was shunned out of the medical profession. But it only...
As they always are when they have anything new to say.
Yeah, anything that's a new, extraordinary mindset, something that goes against the common norm, that's sort of the process it goes through. But the results he was having with patients was so astronomical that doctors began to seek him out to say, hey, help me. I want to learn this and get these kind of results with my patients. And that was the advent of a new medical profession. But the research at the Harvard MindBody Institute and other institutions like this in the past 30, 40, 50 years has definitely put it on the map as far as how it can be embraced for medical doctors who are taught to be skeptical. They're taught, I need the hard science before I can believe anything. Now, none of that is really necessarily the best way to treat patients, but it is definitely an indoctrination that we, as doctors, have gotten from the pharmaceutical industry.
Are you there?
Oh, yeah, I'm here.
Okay. I think I'm going to play devil's advocate just for a second here, and I'd just like you to answer this. One of the things I hear from my much more academically and scientifically oriented people, by which I mean that they're just, if there's not a double-blind study showing that water puts out fire, they're not going to believe it, that type, is that the danger, and I just want you to address this, not because I believe it, but because I want people to hear your answer to it, and it's this. When you see movies like The Secret, which kind of a little bit talks about how important your thoughts are to your health, to your weight, to your metabolism, to your life, all these things, people often mistake that message for one that says, hey, if I just imagine a BMW in my garage, it's going to appear, and that my thoughts have this magical power. I don't think that's what you're saying, but I'd like you to clear that up for those who think that this is kind of that granola secret-y stuff where what you think about can make your cancer go away. Could you address that?
Well, there's two things that I will say to that. And the first thing is, the more we become, quote-unquote, skeptical as doctors, like you got to show me the proof before I can allow a new idea in and question it, is really indoctrinated by the pharmaceutical industry. So their idea of the double-blind, placebo-controlled study is really the best way to test a new drug, and it is the standard, the gold standard for a new drug to be embraced. It is not the standard for really any other kind of healing modality, meaning if someone does Reiki and they put their hands on a person and now the person doesn't have cancer anymore, as a doctor, I would say, that's amazing. I want to know how that works and begin to discover the science behind it. So we discover a new understanding of science because our current understanding says that's impossible and it can't happen. But if case after case after case, in fact, it is happening, then obviously that science is incomplete. The second thing I have to say to movies like The Secret and other teachings like that is that, in fact, if you were to embrace with every cell in your body, I'm holding my hands on a BMW, or I'm cancer-free, or any reality that you are committed to experiencing, yes, in fact, you will bring about that experience. But the way that it happens is this. You experience the inspiration. So for me, a long time ago, I wanted to have a great relationship, an awesome marriage, and really divine partnership where I was loved and cherished and celebrated and accepted for who I am. But I was a far, far away from that in my experience. So what happened, though, was the more I could imagine it, the more I could invite it, the more I can allow it, that does create chemical changes in your body, increases your oxytocin, changes your brain firing pattern. We can see this on functional MRI. And when you change these activity patterns in the brain, all of your actions and behaviors are, in fact, very different. Your tone of voice, how fast you speak, and the types of things that you are saying in the world. So I began singing a different song, and I got a very different result in all of my relationships. So men showed up who were very loving and very caring and very accepting in ways I hadn't experienced before. Now, I know that that's all about me and what I've been creating and how I've been speaking or holding myself, but the fact is that the way you carry your body, the position of your shoulders, open-chested, straight spine, all of that is created by this inner work of, I know I deserve real love. I know I'm worthy of love. So yes, I can affirm that all day long and stay in a room with four walls, and obviously there's not much going to happen. But the fact of the matter is you cannot actually embrace and embody that new belief or that new inspiration without taking action that creates that result. So that's a little, I guess, one of the limitations of how The Secret was perceived, that they thought, oh, so now I just sit in a room and I have a BMW. No, but when you imagine being the successful executive and driving the car of your dreams and living the life of your dreams, having the love of your life, it creates chemical changes in your body, and it creates brain activity changes that will inevitably make it so the actions you take, first of all, it will inspire you into action. You can't not get into action when you're in that level of inspiration, but it will inspire you to take actions that then create that result of success.
That's so beautifully put. I really, I think that's an astonishingly clear way to put that. a lot of the people listening to this in Metabolic Mastery Club are fairly sophisticated about metabolism and insulin and hormones and weight gain, and a lot of people who are here, like a lot of people in the country and in the world, have struggles with their weight and with maintaining a weight if it's where they want it to be, and losing weight or getting to where they want to be if they're overweight presently. Could you address if and how much these kinds of thought patterns, or even the whole field of mind-body medicine, how that might affect the average person who's just like, when am I going to get rid of this muffin top? How would that be?
There's one way that, and I have on my site, there's like 3 major patterns that keep people from healing. But one of the things that happens, like if you try to lose weight, it's like, oh my God, I hate my body. I'm so fat. I have to lose weight. I have to do it. I'm going to push myself to do it. I'm going to make myself do it. I'm going to go on this new diet. That's that. What is happening there is I'm fighting my body. And so whenever there's resistance, like I'm resisting and judging my body, and when people say I'm so fat, that's a judgment. It's a derogatory term. Well, with all the thoughts that you have and the judgments, the beliefs, perspectives, your cells are listening. And what happens in that system, your cortisol levels go up, stress hormone, just to keep it really simple. Cortisol makes you gain weight. It makes your body hang on to excess weight. So you're creating the very resistance that you're working to, quote unquote, fight against. You cannot lose weight by fighting your body. You can only come into harmony, self-love, self-acceptance, and allow your body to shed the weight by coming into your natural state. But what happens is people are like, no. I could not possibly accept this 20-pound overweight or 100-pound overweight. I'll never accept it. It's not okay. So what happens is it needs to be the first step, and just one step initiated in trust. Okay, fine. I'm going to listen to what Dr. Kim says. I'm going to allow just a little eke of some self-love in, and then just see what happens. Is my body going to come into greater ease? Well, even that little small bit of self-acceptance to initiate the process will decrease the stress hormones, decrease the inflammatory cascade, change your brain firing to decrease cravings, and it will support you in your weight loss journey. So that's one example of kind of releasing that. You are the source to create that change, and then the actions and behaviors of, yes, you're going to eat healthy whole foods that are real foods. I mean, you're not going to eat McDonald's and think you lose weight, but when you come into this mindset, you will naturally be inclined to enjoy those foods anyway.
Oh, that's so well put. And I recall something that one of the most influential teachers I ever had in my life in the 70s, Werner Erhard, used to say, which is, what you resist persists. How's that for an aphorism that sums up what you just
And we
talked
now have medical science to show how that is translated in the body and to translate into disease or into health and well-being.
Yeah, that's great. So would you look at someone who's overweight, or would you look at excess weight, unwanted weight, as something that needs to be healed?
It's a reflection of an imbalance in the body. It's a reflection of, now first of all, everyone is not meant to be slim and skinny like a supermodel.
Right.
You see incredibly healthy, empowered people. Queen Latifah is a perfect example. She carries more weight, but she does it with such vigor and vibrance that you can tell she embodies health and empowerment. So it's not
can
that,
you talk closer to the microphone, please? Because you're falling in and out of audio. So
oh, sure.
Thank you. Go ahead.
So we're not all meant to embody a slim body, a slim supermodel body. But there are people who kind of really do, they are the picture of health or of empowerment. And then you realize, like, they're beautiful, they look amazing and vibrant, independent of how much they weigh. However, when someone is imbalanced and clearly above their ideal weight, there's always some kind of a chemical imbalance that matches that, meaning there's an inflammatory cascade, there's the lower antioxidants and higher oxidative stress, oxidative damage, toxins in the body's not detoxifying well. And you could go to a functional medicine doctor and look at your biochemistry and then take some supplements to micromanage your biochemistry and quote-unquote fix the problem. Or you can ignite self-healing, the very essence of what keeps you alive that already knows your set point for your ideal weight, that already knows how to help support your kidneys and detoxifying and your liver to detoxify your body. It's like a master healer you have access to within your body that the MindBody tools ignite or access you to that will allow all of that balance to happen on its own.
That's wonderfully put. And I think what you're saying is something I've said for years, and I think we're probably in agreement with this, but I just want people to hear it again. And that is that the language that we use to speak to ourselves actually makes a huge difference. It makes a difference in goal setting. It makes a difference in all of the metrics that you were talking about, from hormones and cascades and inflammation. And I'll give you an example that I learned from Jack Canfield. He was saying about goals being specific. Like when people say, I want to lose some weight, I'd like to get in shape, it ain't going to happen. But when you put that goal in the language of, I will weigh 150 pounds on June 30th at 5 p.m., it becomes specific and actionable. Do you agree with that?
One of the things you've got to be careful with that is, yes, that will work brilliantly if it is something that really fires you up, makes you excited. Oh my gosh, by the end of this summer, I'm going to have achieved this goal. That's awesome. What you're doing is you're igniting that chemical response of that. You'll feel the sense of well-being. You'll feel the sense of vigor and vitality, and that is reflective of what's happening chemically. So yes, you're on track. If instead you say, oh my gosh, by the end of the summer, I've got to lose this weight, and that's it, and I will, have this much weight on the scale, and I will have this much success. And now you're fighting, and it's a stress response because you're like, I'm fighting my body, and I don't really believe I can do that, so it's going to cause me some stress to imagine doing it and to imagine forcing myself to do it. All of that ignites the sort of negative chemical cascade that makes you sick and that impairs your ability to follow through on that result. So I would say yes and no. There's a caveat there, and that's why it's not universally working for a lot of people where they're like, I set these goals, I did these affirmations. When it's done in the mindset or the energy of harmony and self-love with ease, yes, of course I'm going to have this. I deserve love in my life. I deserve well-being and to be at my ideal weight. Then your chemistry will cooperate with that. And you can feel it. You can feel the difference between A and B by how much it makes you feel connected with inspiration and well-being. So you got to use your inner compass as a guide.
That's really brilliant. Kim, I know you're almost out of time, and I could talk to you about this the whole day, but I'd love you to just pick one or two of the tools you use in the MindBody Tool Kit, that #1 bestseller on Amazon, which is sitting on my couch, and I'm so ashamed to say I haven't read it yet, but you were telling me offline, you don't really have to read the whole book. You can read 2-3 pages and get some value out of it, and then just open it like the I Ching at another time and read another 3 pages. So that's
I've had so many people tell me, I'm like, wow, just reading one chapter of this book for the last 3 days, I'm higher than I've ever been. It made a huge difference. So yes, I'll share one of my favorite tools. This one is really, can you hear me okay?
Yeah.
Okay. This one's kind of the foundation for all of my work, and we can go much, much deeper. And I do have a special bonus for your people so they can get this tool on a much deeper level. But it's called the Instant Elevation Technique. And this will instantly bring you into that state of well-being, which is a chemical, mental, emotional state. So it's a tangible experience in your body, not just the idea. And it's called the Instant Elevation Technique. So there's 3 parts. It's A, B, C. A is aware. You're going to bring your awareness into your body. Now, when you do this, it's like when you tell somebody, stop worrying about that, or, don't do this other thing, don't think negative thoughts. You can't really do that, but you can change, and you can bring your awareness into something that is going to be more balancing for you. So when you bring your awareness into your body, you immediately turn off the toxic thinking of, oh my gosh, I can't believe this person did that to me, or, oh, I shouldn't have done that in the past, I feel so bad about it. Or you're thinking about the future, and then there's anxiety and worry about what might happen, what might not happen. All of those chemical cascades floating around in your bloodstream will immediately tune out, so they just fizzle out when you bring your awareness into your physical body. Your body only lives in the present. You start to feel what's happening in my body. So just feel physically first. Most people, they're not aware of their emotions, and in the video I walk you through how to get more clarity and awareness of your emotions, one of the most powerful things, one of the most powerful skills that you can possibly develop. So you just bring your awareness into your body and bring it all the way down toward your pelvis, so you really ground part of your attention in your physical body. That's the first piece. The second piece is when we're stressed or worried or fighting or any of these times, you're like, oh my gosh, I shouldn't have eaten that. You want to actually, you're in a breathing pattern. That's a stress breathing pattern. We breathe shallow. We breathe into the chest. In fact, you want to breathe all the way down to your belly to get that relaxation response initiated, the healthy chemistry that's going to heal your body. So B is to bring your breath slow and deep, and bring it all the way down to your pelvis. Let your belly balloon out with the inhale. And let your belly sink back in with the exhale.
Mm-hmm.
And you do 3 of these anytime you practice this tool. Anytime you notice that you're stressed or you're like arguing with your spouse and you just have to say something, you want to strangle this person, you just slow your breathing, bring your awareness into your body, and you begin to slow your breathing and bring it all the way to your belly. This actually turns off the fight or flight response. That's called the sympathetic nervous system. It turns that off, and what naturally happens, which is your natural state, is the opposite, the parasympathetic nervous system, which is the relaxation response. It'll sort of spurt out juicy chemicals that make you healthy, oxytocin, antioxidants, endorphins that decrease pain.
Mm-hmm. Mm-hmm.
The third piece is choice, choose. You're going to choose from a more empowered space. So now that you've gotten your awareness connected in the present moment in your body, you've slowed down your breathing and turned off the stress, fight, or flight response, you have the ability to set an intention for choice. Okay, I choose to live in a healthy body at my ideal weight. Or I choose to create a loving marriage and not keep fighting with this person. I'm going to choose something higher. So that's part of choice. And then the other part of choice sort of happens naturally. All of the actions you do are going to be different. You might stop shouting and just be still and listen. Or you might stop eating the chocolate cake and just keep your awareness on your body and send yourself love and find that that decreases the cravings. You don't even want the cake. So if you do this ABC tool before you eat, before you exercise, before, after work, before you come home, like transitions, it is incredibly powerful to convert your system to one that automatically creates the results, actions, behaviors, choices that bring about your ideal life.
God, that's fantastic. I was doing the breathing exercise as you were talking it through, and I literally felt myself begin to relax. My breathing slowed, my pulse rate went, more normal, lower. It's really effective. And let's tell everybody again about your book, the MindBody Tool Kit.
The MindBody Tool Kit. They can find it at drkimd.com. It's Dr. KimDeramo, but Dr. Kim D for short will work, drkimd.com. But I have a really great package for your listeners because I know they're in a special program with you, so I put together a really valuable bonus for them. So it has that. And it has the instant elevation technique, the tool I just gave you, but we go even more in depth so you can get a lot more out of it and practice it. It also has a series that I've done to teach people something called EFT meridian tapping, emotional freedom technique, really powerful for weight loss and really powerful to immediately turn off the stress response. And I knew we wouldn't really have time to get into it too much, so I'm gifting that.
That's a great subject. I'd almost like to have you back to just talk about EFT. A lot of people have asked me about that. I've dabbled in it and investigated a little bit, but I would love to interview you just on that subject. That's something I think
we should do that. It definitely merits a full conversation. It is amazing. It's one of my favorite mind-body tools. And there's a really, really important part to how I use it that I haven't seen anyone else do, and it's a real key to how to get it to work universally. I also gave them the first. Sorry?
How did I get the bonus?
Oh, so there's other stuff in there too. You go to drkimd.com/metabolic mastery, because that's the name of your program.
Right.
drkimd.com/metabolic mastery, and they'll have all of those that I talked about, plus a whole bunch of other stuff that I put in there as well.
That's wonderful. And by the way, that's D, the fourth letter of the alphabet, in case anybody didn't hear that. Dr. Kim,
yes, D like dog.
D like dog. And Dr. Kim, thank you so much for taking this time out of your day. This has really been helpful and useful and valuable. And I know people got a lot of value out of it, and I hope that they will search you down on the internet and read your book and follow you and like you on Facebook and all the other stuff you're supposed to do. And yes, I hope that I look forward to when we see each other again, I think in August, right?
Yes, I can't wait. I'll see you soon. I'm really looking forward to it.
Thank you so much.
All right, lots of love for everyone, for your well-being. Keep believing in yourself. I will support you in getting there.